Hello, Mr. Reynolds. How are you doing today?
Good.
I'm Jared Whitmire. I'm an exercise physiologist. I'm just wanting to get an idea of why you're here today. So I'm going to be asking you a few questions, if that's okay with you.
Yes.
Okay. I just wanted to see how you were feeling post-stroke. So how have you been feeling the past few months?
I'm feeling alright. A little better than 3 months ago. Still a little off, but it's getting better.
Tell me a little bit about the weakness in the right side of your body you've been experiencing.
Yeah, it's still a little bit weak. Therapy helped just a little bit. Difficult riding on my right side, so kind of avoiding the whole riding. And left side, I'm using it more.
Okay. So you're just having a little trouble with grip? Like, is it hard for you to hold on to it?
It's hard for me to hold on to it, and my coordination on my right side is just off, so it's just all around difficult.
Have you been feeling dizzy?
Yeah, definitely dizzy. My balance is probably the reason why I'm getting a little dizzy, and my eyesight's definitely worse than before. And I can't really see far away, and I'm experiencing a little bit of double vision as well.
Okay.
So
that double vision could be leading to your dizziness?
yeah.
Okay. Do you feel better when you're in a seated position like now? Or you feel so unbalanced or anything?
Yes, the balance is better when I'm seated. When I get up, it takes me a second to maintain my balance and coordination.
Okay. So definitely seated position is better for you right now than if you were standing. Tell me a little bit about the depression that you're experiencing. Was that before the stroke, or did that occur because of the stroke?
The depression definitely came about after stroke. Adjusting to having to take all the medication. It's definitely new to wake up and perform daily activities. So being retired, I don't have much to keep me busy, and it's just a little off for me. So I think the depressions came after the stroke, definitely.
Okay. Tell me a little bit about the physical activity that you used to do before the stroke.
I can't really tell you when the last time I've been physically active. I didn't do much before the stroke for a while. Retirement had a lot to do with it, and before retirement I just had a huge workload, so not much physical activity.
So the work that you did, or your previous occupation required a lot of physical activity though?
It required just a lot of work, busy work, not a whole lot of physical activity.
Okay. Alright, so I mean, that's fine. A lot of people in the United States aren't very physically active, but that's why they have people like me here to help. I just want to go over, how was your diet before the stroke?
I wasn't really taking the right measures for my diet. With my diabetes, I should have been eating better, and I just kind of got lazy with it and ate how I want.
But I hear from the doctor that they have you referred to a dietitian right now, right? Trying to correct some of those diet habits.
Since I've had the stroke, the dietitian and we've got a really good diet plan for me, and I've been sticking to it.
Okay, well that's great that you've reached out for some help there, because I only cover one aspect of this wellness program that you're going on, and I want you to understand that this is going to be a multifaceted area that we're helping you. We want your nutrition to be right, and also your physical activity to help you get better. I just want to also go over a couple of things about what we're going to be taking you through. This is called Exercise as Medicine, and basically it's some guidelines that ACSM, it's an accredited organization that we go by here at Limitless. And it can tell you right here, I'm going to give this to you after the interview so you can look at it. Exercise can help with depression, it can help with diabetes, it can help with hypertension and stuff like that. So all the things that you're experiencing, and it helps with obesity. Everyone seems to know that one. But really what we're trying to emphasize here is that exercise is medicine, and that this is going to help you your overall wellness. And so is the dietitian that you're going to. They're going to help you as well. So really I just want to motivate you to come here, and I want you to understand that we're all here to help you, and that every step of the way I'm going to recommend that we give you a diary so you can log in how you're doing and stuff. And I'm going to be in contact with your family members, your wife, just so she can tell me how you're doing at home and stuff. So really we have a whole team that's devoted just to you to help you get better post-stroke. So I'm looking forward to it. I'm going to refer you to the programmer, and they're going to help get you set up on a program. We're going to take all the information that we have from your doctors, and we're going to help you get set up. How's that?
Sounds great.
Okay. Well, it's very nice meeting you, and we're going to get started, okay?
Time and increase the speed as you wish. And then we'll do a cycle ergometer test on the bike. And both of these we're going to be measuring your heart rate, blood pressure, and keeping a check on your ECG. And also we'll be doing a digital dynamometer test, and simply your grip strength in your right hand versus your left hand. And I know on your medications, one of them kind of has side effects of nausea and vomiting and things like that, stomach ache, and we're going to make sure that if you do start to feel kind of sick or dizzy, that we'll terminate the test and make sure you're okay. And then this is going to be, it's called the Borg scale. It's a scale from 6 to 10, or 6 to 20, excuse me. And whenever you hit 17, that's when we will terminate a test. And if you don't hit it, then we'll simply keep going until you do hit fatigue, okay? How's that sound? You ready to get started? Mm-hmm. All right.
Okay, Mr. Reynolds, for the next test, we'll be performing the gait test, which is just a simple test that will check the functionality between both of your legs. What we're going to be doing is, you're going to be taking one step at a time, starting with your right foot, and we're just going to measure the stride lengths. And we're going to take a step at a time with each foot to that blue line. I'm going to be here to help you, okay? Are you ready to begin?
Mm-hmm.
Okay, take a step with your right foot.
5.5 try.
Okay. Okay, now with your left.
9 inches tray.
Inches. Okay, with your right. You feeling all right?
Mm-hmm.
Feeling okay?
About 6 inches.
Okay, now with your left again.
About 8.5.
All right, now with your right again, please.
Just about 6 inches. One last step
One more
first.
time.
About 7 inches.
Okay.
Awesome.
Okay, we can go take a seat now. Okay, Mr. Reynolds. Now we'll be performing the second part of the gait test, where we will have you just take normal steps to that point, right over there, that little white line. And I'm just going to time you. That way later on, when we get down the road with exercising, we can see if you've improved getting from point A to point B. Okay, you ready? My assistant Chance over here will help you. Okay.
Yeah.
Ms. Reynolds, how are you doing today?
I'm okay. How are you?
Good. My name is Brittany. I'm the personal trainer here at Limitless. Today I just want to tell you about the program that we're going to have you go through. It's going to basically just prevent you from another stroke recurring and improve your quality of life.
Okay.
We're going to put you through different modes of exercise. We're going to have you do aerobic exercise, strength training, flexibility, neuromuscular, and a little bit of mind-body as well. I'm just going to break these down for you a little bit. The aerobic exercise is just going to decrease your risk factors of cardiovascular disease. So it's going to decrease your blood pressure, your ADLs. You said you like to cycle, right?
I do.
Okay, so we'll have you on a stationary cycle. We'll have you on a treadmill. We'll have you walking outside. Initially, we're not going to have you in the water right now because with cardiovascular disease, you can limit your breathing a little bit. So the strength training, we're going to have you doing isometric machines, isokinetic machines, and just really light resistance weights right now, and then maybe progress you later on.
Yeah.
That's just gonna increase your cardiovascular disease risk as well and improve your muscle weakness. Since you have muscle weakness on the right side, will improve that. Flexibility, it's just gonna be basic stretching, prolonged stretching, not any ballistic stretching that's gonna make you uncomfortable. It's just gonna improve your range of motion and get you feeling like your balance is better and improve your gait as well. And the neuromuscular exercises is just gonna improve your coordination and balance. That's gonna go hand in hand with your strength training, so we'll probably do that on like the same day. And the mind-body exercises, have you ever heard of Tai Chi?
I have.
Yes, we'll be doing a lot of that. We actually have a Tai Chi instructor here, so you'll be getting participation with other people in the Tai Chi group exercise class. Have you ever used a Wii before?
I have not.
Okay, well, we also have programs on the Wii that you can do even at home. So when you're not doing this exercise program, you can benefit from the Wii and all the programs that we have. We're going to send you home with all those too.
Okay.
And so do you have any questions about the program, or do you have any questions about the exercises?
I don't have any questions, but it sounds like you put a lot of thought in this program for me. I'm excited to get started on it.
Yes, definitely. And we're going to be contacting your wife and other people who are with you during your daily activities just to kind of see how we need to progress it and modify it if we do need to at all. So we'll definitely be working with everybody and helping you. So
That
you ready
sounds
to
great.
get started?
Yes, it does.
Okay.
Are you excited about today?
Yes.
Hello, Mr. Reynolds. How are you doing today?
Good. How
It's
are
good
you?
to see you.
Hi, I'm Chelsea
Oh,
Reynolds.
my name is Trey. It's nice to meet
Very
you.
nice to meet you. All right, hun. I'm gonna leave you with him, and I'll be back in about an hour. Okay?
Okay.
All right. Y'all have fun. Thank you.
All right, Mr. Reynolds, if you step on in here, we're going to get started with the exercise programming.
Okay.
We're gonna have a couple tests that are gonna work with your help with your neuromuscular activity, because sometimes after strokes, patients have trouble getting that action into motion. Sometimes. So this will help with making that mind and muscle connection. That you're having trouble with on your right side. Okay, so first we're gonna have you extend your foot out here a little bit. And my partner Trey is gonna wrap this band around your foot, and it's gonna add a little bit of resistance just to kind of help with the motion of it. All right. And at the same time as you're gonna twist your foot out just like this, and as you do that, I want you to squeeze your hand at the same time. So it's kind of like muscle activity, to kind of make that connection. All right. So first you just start with trying to move your foot out at the same time. Okay. Okay. Now this time work on trying to do it at the same time. As your foot's going out, squeeze your hand in. Okay, you're getting better, you're getting better. All right, now let's try it one more time. Let's try and get it at the same time. There you go, that's it. Exactly what we're looking for. Okay, now back in. Release your hand. Back out at the same time. Good, there we go. You feel that, you feel like that mind and muscle connection, kind of putting two and two together at the same time. It might be a little bit harder, I can see that you're kind of really focusing on it. So this time let's try and do it as you're looking away this time. Just kind of look out at the horizon. All right, ready to go. Squeeze that hand. There you go. A little bit later, all right, let's try it again. At the same time this time, you got it. There you go. And then releasing as you're going back on your foot. Good, that's great. Getting better. Next we're going to work on your strength aspects, because I know that you're kind of weak on your right side, so this is going to try and help just, us just strengthen your right side, kind of bring your right and left side together, So first we're going to start out, we're going to have you holding this dumbbell right here. We're going to have you hold it in your right hand. And whenever I say, we're going to have you lift your hand up right here. At the same time, I'm going to have you do a overhead shoulder grip with this dumbbell with your left hand. I'm going to have you do 5 reps with your left arm while you're holding this arm. I'm going to tell you when to start. All right, go ahead and start now. Just hold this arm out straight for me. All right. Doing great. There we go. That was great. All right, now we're going to move on to the next exercise. All right, Mr. Reynolds, on the next test, we're going to have you, we're going to work on your balance. So we're going to have you stand on this balance board for us. And just kind of give us an idea of how much, balance you really have. And during that test, you can put all the weight on the tray and as you need, as long as you feel comfortable. And we're just going to see how long you can hold it. All right? At this time, we're going to have you go ahead and stand up for us, and we're going to have you place your left foot on the board first. All right. Nice and slow. All right. Add your right foot on there. All right, go ahead and start the timer tray. Okay. You're doing great so far. Feel comfortable? Okay. All right. Let's start You're right, anyone's comfortable. Alright, great job.
What do you think of your first day of training?
It is pretty rough. You know, it's definitely gonna take some getting used to.
We're gonna have the same layout throughout these next 4 months, and then we'll try and reevaluate about 4 months from now. We'll take you through the exercise testing again. Today we did a seated stepper. You seem to have a little rough time with that, so we'll try and do some other things that are aerobic, are gonna train to get your heart rate back up, because we wanna work on that, get you to a fit level. We have arm ergometers, treadmills, and I'll be sure to show you all what those are in the next few weeks. We wanted you to cycle because earlier you had said that you like to cycle a lot, is that correct?
Yes.
Okay, so we'll make sure to add that in there for you.
Great.
Strength training, we really want to make sure your grip gets back to where it used to be. I want to make sure that you're able to write and be able to hold on to things. That's why we have some of this isometric training that we're having you go through. Flexibility, we just want you to have normal range of motion. Once again, to increase those activities of daily life. Neuromuscular, that was the balance and coordination. And don't worry, I'm gonna give you this sheet for you to take home so you can kind of see what we're doing and how we're progressing and stuff. And if you have any questions about it, just make sure to call me or next time. You were saying earlier in one of our interviews that you had depressive symptoms. Can you tell me a little bit about that?
Yes, I am recently. I mean, I just never thought anything like this would ever happen to me, you know?
I understand that feeling, and I just want you to understand that we have a whole team that's dedicated to you, and we're gonna be here to help you. We can also suggest that you might wanna go see a therapist to help you out with some of the emotions that you may be going through as well. And your wife's always there for you, and we're in contact with her, so we have a group of people surrounding you to help you out through some of these symptoms. Also, we didn't do it today, but twice a week we're having you do Tai Chi, and that's gonna help you relieve some of your symptoms. It's just a time to relax and really take in what's around you, and we'll have you do that twice a week. Does that sound okay?
That sounds fine with me. And I really appreciate y'all being here for me.
And also, if it's something that you don't want, we can always reevaluate and try something else, if that's okay. Alright, well, we had a really great day today, so I look forward to seeing you tomorrow. I think your wife's gonna be here in a few minutes. Just feel free to hang out with me for a while. We can just
Okay.
chat. Alright, so we'll just wait for your wife to come, alright?
All right, thank you.
Hello, Ms. Reynolds. This is Brittany from Limitless. How are you doing? Great. Well, I just wanted to gather some information about Mr. Reynolds. How's he doing? And are you having to help him a lot around the house, or is he able to do most things by himself? Okay, great. So it sounds like the programming that we have him going through is helping him. Perfect. Well, that's just kind of what we wanted to know, just so we can know how to progress him and modify his programming. So we'll see Mr. Reynolds tomorrow. Okay, have a great day.